Good evening and welcome to the second district monthly COVID-19 webinar series. I've been your host during these times, and I'm happy to report that this will at least be the last COVID-19 call with me serving as the district representative of the mighty second district. Certainly, it's been an honor. It's been a pleasure to serve with these astute men, my brothers, but most importantly, my friends of the greatest fraternity on this side of glory, the Omega Psi Phi Fraternity Incorporated. Certainly want to acknowledge them, salute them, and just thank them for their support throughout this whole time that we've been dealing with this pandemic. So let me not belabor. Let's go ahead and bring our four horsemen in. You all know that every time we do this show, this brother has just blown us away with knowledge and the facts and the data. That's all we wanted to do. We wanted to make sure that we wanted to make sure that our communities had the most up-to-date information as it relates to this virus, this coronavirus. So with no further ado, 78 is what we call him. Certainly Dr. Keith Boykin, no stranger to us. Dr. Boykin, we just want to thank you for all that you've done throughout this pandemic, giving us the information, giving us the knowledge. Additionally, as we all know, the epicenter where this all began in New York, and Dr. Jedan Phillips, we call 88. So Dr. Phillips was, from the beginning, giving us up-to-date information with everything that was happening in New York. So for right there, let's just start off 78. Dr. Boykin, let me open up with you. Please, your opening remarks.
Well, thank you, Brother DR. I appreciate that, and I want to say at the outset that I appreciate your direction that you've given us during this time. And we could not have done this without you. I mean, you've been instrumental in helping us get this message out to the people. And I just want to a couple of things I think that we need to talk about a little bit, because I think the world has kind of gotten off the whole COVID-19 is still real deal, and they're still trying to return to some semblance of normalcy. But we know that we still have to keep our vigilance up, because right now we're over 80 million cases reported to date of COVID. And, there was a point in time like last month when we did this webinar, cases were going down, everything was looking good. But if we contrast the beginning of the month, where there were about 27,000 new daily cases at the beginning of the month, now it's jumped up as of yesterday to 63,000, a little over 63,000 cases per day. And the other sad statistic that we are approaching in the United States, we're almost getting to 1 million total deaths reported to date. Now, the good thing about that is that there were, at the time of around March 29th, there were about 716 new deaths per day, but now we're on 347 new deaths per day. So that's a good statistic that I want to bring to you, but we're still got to be wary that COVID is still out there. Hospitalizations over 4 million to date, and right now we're having about over 1,800 current 7-day average, and most of these are people over the age of 70. And the next thing that we want to talk about is that we forget about that when we looked at all this, kids were the biggest problem in this whole thing in terms of hospitalizations and death. And another sad statistic I want to bring to you tonight, that over 400 children that were sick. The CDC study, so over 400 children that were sick. They were mostly children between the ages of 5 and 11 years old. 3 in 10 had no underlying hospital conditions. 9 in 10 were unvaccinated. So you see that the highest number of children that were hospitalized in the United States in this age group were unvaccinated. And 2 in 10 did require some ICU admissions. So if you looked at all the cases together, over 12 million total child COVID-19 cases have been reported to date, which is representing about 19% of all cases. And when we look at that particular study by the CDC, again, sad statistic is that the majority of these kids that were admitted to the hospital that were sick or got COVID were non-Hispanic Black children. They represented about 30% of the hospitalized children with no underlying causes. And, the two biggest factors there were diabetes and obesity. And we know that, in the African-American community, most of us have problems with obesity and diabetes. But in our children, it's a national pandemic right now where we're having a lot of obesity. So it doesn't surprise me that when it went back and analyzed all the data from the children hospitalizations, that a large majority of these were African-American children. Now, you know, and I guess the next big thing is we're talking about, what about the variants? Well, you know, the other thing about the variants is that, you know, we always said it was just BA2, but, you know, the CDC always slides something, or I should say the World Health Organization always slides something in on us. I did not know until I was doing some research today that there was another subvariant of the BA2, and that is BA.2.12.1. And right now, that's represented about 28.7% of the circulating cases, of which BA2 is about 86% of all the United States cases. And BA.1, which is the other variant, is 28%. And the original BA2 is still at 0.2%. Don't hear much about Delta, but if you look at statistics of children being ill and infected with this, there was a study done where a lot of these children were more apt to get infected by Omicron, which is BA.2. I want to clarify that. But they didn't get as sick as or hospitalized. A study actually done would show they can contrast and compare those with Omicron versus those with Delta. And of course, Delta was more significant in terms of severe illness, but it infected children as much as Omicron. More children got Omicron and were not hospitalized. Less children got Omicron and had more significant problems with that. And the last statistic I want to leave with you, again, is what's happening in the African-American community. You know, African Americans are still not being vaccinated that well. We're still, you know, not heeding the points. I want to just grab some information here real quickly about where we are with that. I apologize. I had written it down and I forgot what I did with it. But I know we're not where we want to be in terms of African American community. We're only like 12.7% have been vaccinated in the last 14 days. That's a decrease from last month. You say 12.7% sounds good, but that's a decrease from last month, the last 14 days. A little bit up, 10.3% of us have had at least one dose of the vaccination. 13.2% have completed the vaccination in the last 14 days. Again, that's decreased, but slightly increased overall that 10.1% African Americans are fully vaccinated. 11.6% of us have received our first booster in the last 14 days. Again, that's decreased. But 8.3% of African Americans have received at least one booster. So, you know, we still got some work to do here. And I think this platform that we're doing here has brought a lot of information out there, but, you know, we still have a long ways to go. And I want folks to understand that while we're having a great time, you know, even I think I heard somewhere say today that Dr. Fauci said we're out of the pandemic. It's like becoming an endemic, and it's not going to go anywhere. It's going to stay with us. And I'm very concerned because, you know, we forget about the other virus out there, the flu virus. And right now we're seeing an uptick in pediatric deaths from the flu virus. So we're seeing that, and we see have COVID going on. I mean, you can imagine how it's going to be as we go forth. And, you know, COVID-19 has ruined another summer, they say. But, you know, all I say is use your head, be smart. You know, we got to be smart about this because we cannot stay in the house all the time. We can't keep cooped up because, you know, because of this pandemic, there was an increase in adolescent suicide rates, particularly they were higher than the pre-pandemic rates. Older adolescents were more apt to commit suicide. So we got a lot of things to do. And even though we got people in the African-American community, adolescents that are committing suicide, and a lot of it's not going unreported. So I just want to take that time to say all those things that we start out and kind of yield back my time. And I know we got a lot of things we'd like to talk about tonight, but those are some things that I want to just put out there while we're still on this subject.
And as always, Dr. Boykin, you always bring it to us, and man, we appreciate that. Let's go to Dr. Phillips again. Dr. Phillips, we appreciate you, man. When this thing started, you were right there, giving us, you know, live, up-to-date information. Talk to us, team. Put us in the cut.
Well, good evening, and the first thing I want to say is, Brother DR, Brother Ampofo, this couldn't have happened without your support, my brother. You know, I think, you know, people say that we saved lives. Maybe we wouldn't have been in the position to save lives if our leader was not 125% behind us, which you have been throughout. So I thank you for your enthusiasm about science and good information, because I think that, again, as we enter this new chapter of this pandemic, as Dr. Boykin said, yes, it was said today by Dr. Fauci that we may be past it. However, we're seeing some concerning things, not disturbing, but concerning. We've seen a jump in the cases nationwide. And for me, it's particularly concerning because half of that increase has occurred in the New York State area. Mm-hmm. So this Northeastern area has unfortunately been hit with an increase. Why is that happening? We have the rolling back of masking and other safety measures that have been in place. We also have people that are tired and they want to just forget COVID and act like it never happened and move on. In addition to that, the time of the year, we just had Easter, we had spring break for the children, we've got Memorial Day upcoming, we've got graduations, proms, all of these occasions where we're going to gather. And again, I think as we start to approach this, each of us have to look in the mirror and say, well, what are my risks? And what am I doing about my risk? Again, as I've said now before, and I'm saying now, the best thing that you can do to protect yourself is to get vaccinated. And unfortunately, one of the things that we're seeing is a lack of follow through in the vaccination. I got the first shot. I didn't get the second shot. I may have got the first primary 2-shot series, but I never got the second booster. I may have gotten the first booster, but even though I'm eligible, I didn't get the second booster. So again, you know, that is one of the means. Masking. We're seeing people, you watch the NBA games, which I've been watching, you rarely see anybody with a mask, so again, we are relaxing our masking. However, one of the other things that I'm seeing as far as a primary doctor is people that have chronic conditions that may make them higher at risk for COVID, they're not doing anything about it. You may have heard before COVID that your blood pressure was high. You're not doing anything about it. I see too many people I'm hearing about having heart attacks, having strokes, all of these having diabetic complications, all of these situations that are preventable. But as we've jumped into COVID, we forgot to focus on ourselves. Right. And in forgetting ourselves, we are not, as I said a few moments ago, we are not controlling our own personal risk. So again, even though New York State may not require a mask, if you're a person that has poorly controlled diabetes, poorly controlled heart disease, obese, asthma, things like that, or you haven't been vaccinated, your risk with COVID, if you get infected, having complications are going to be higher. So again, I'm not saying to tell you what to do, but I am saying that you need to do what you need to do to mitigate, to reduce your risk, because unfortunately, still the most severe cases that we're seeing are people that have complicated, out of control chronic conditions, people that have not been fully vaccinated as they're eligible, people that have been in unsafe situations and circumstances and have those risk factors. So again, these things are really, really a problem because, as Dr. Boykin just said, we don't really have a whole lot of vaccine in communities of color to protect us. So we are still running with a high vulnerability to this. And it's particularly concerning because of the highly infectious nature of the Omicron variant and its subvariants. So with that, excited for us to have this conversation. We're going to make it good tonight for you, Brother DR, being that it's your last time with us. And again, what would this be without you?
Nah, I appreciate you. And, as I said in the beginning, it's been the 4 horsemen. And so certainly we would never forget our good brother, our friend, the only brother that's not a doctor, but the information this brother brings, it's just dynamite. So Brother Wonzie Gardner, I want to say good evening to you, my brother, and welcome. And certainly would like to hear what you want to share with the people on this evening. Good to see you, my brother.
Brother Fofo, I'd like to echo the words that my 2 big brothers have already spoken about your presence and your leadership and getting us to this point. And it's kind of a sad day to hear that you're saying it's going to be your last time, because we've looked to you for your leadership, your guidance, and your steadfastness in getting us to this point. And I'm having mixed emotions because although I may be older than you in age, You are senior to me in your wisdom in the fraternity and what you've done, what you brought to us each and every week, and the wise counsel and getting us in front of the Supreme Council and the grand bosses to understand the importance of what we've done and to be that voice in the wilderness and let people know that this is serious. Our community is always the last one to come forward sometimes. And through your leadership and through the efforts of my brothers on the screen and Brother Guyton who's not here, we've been able to at least give our community a glimpse into what could be and the possibility of how we can move forward. And so brothers Boykin and Brother Phillips talked about the pandemic going to an endemic. And what I like to focus on is what does that really mean for us as we move forward as a people and as a community. I was in a meeting at the on the White House Labor Task Force, and we were talking about that. And it seems like now we're looking at things as though everything's okay, and it's not. And what's happening now is the best way I can put it is this is now becoming a personal issue. Before the government was involved with it, before the government was trying to direct and do things for the good of society, I've always made the statement that my rights end where yours begin. Unfortunately, we're living in times where people don't know that anymore. We're not concerned as a group about our fellow man. And so as we go from a pandemic to endemic, it's very important people realize that there will be no more big brother to watch over you, just tell you what's going on. And you're going to have to take these precautionary measures for yourself, like vaccinations and masking and things of that nature. I remember as a little kid, my father was in the military, and I've always had a shot card, a shot record. And it's still amazing to me how something that is so good for the body politic has been made into a political issue of getting vaccinated. And I'm not here to debate about it. We have our doctors here, we have our scientists, but I've listened and I've learned. And in my short time living, and when you see so many people dying and so many people getting sick, then you've got to do some things to make sure you take care of yourself. And my biggest fear is this: as we move forward, that we're going to lose sight of the fact that people are actually dying from this disease. We're going to lose sight of the fact that people have already suffered and things are going on. I recognize we always all want to get back to our normal standard of living. And what scares me the most about it right now, Brother DR, is this. We're getting to the point now, unless this impacts you personally, it doesn't exist. And I'm going to say that again, unless it impacts you personally, it doesn't exist. And that's a scary time for a country like ours when everyone's thinking about self. I wish we could go back to the days of when the community was larger than the individual. But unfortunately, the individual is larger than the community. So as Brother Boykins and Brother Phillips talked about, it's about us taking care of us and being on the point for us. So those are my opening remarks. I'm looking for a good discussion, and thank you very, very much for allowing me to say a few words at the beginning.
No, absolutely. And we appreciate you, Wonzie. We really do. So the Horseman, Dr. Boykin, I think you mentioned it as it relates to this COVID being on the rise again. Talk to us a little bit about, what increases we're seeing and, your thoughts about, this spike, if you will. Just make sure you come off mute so we can hear all that good information you want to talk to us about.
Sorry about that. Sure. I mean, as I said, the cases have just, probably from almost the beginning of the month have almost tripled. So we're seeing that. And I think it's because we're seeing more of the, as I said, we first started out with just the Omicron variant itself. Everybody knows the original Omicron variant, but then it mutated into BA1 and into BA2. And the BA2 is the one that's causing all the havoc. It's on the rise. Now, we know these viruses are pretty smart about, doing their thing and, changing their infectivity and transmissibility rates. And that's why we have the flu forever, because the flu always changes. And the thing about viruses is that we always have to catch up to where they are. So, we know we've got this BA2 now. We got to figure out what we got to do with that. So to that end, new medications have come out all the way down to 28-year-olds for treating and preventing BA2. But I think because we're just getting it, and as Brother Gardner just said, if it doesn't affect them, it doesn't exist. So that's why we're seeing a rise in these cases, in my personal opinion. And as Dr. Phillips said, I did read where cases are on the rise in New York and New Jersey. And again, I think it's because that's where the epicenter started at. But I think the whole idea is that because from the peak in March to January to about now, people are just saying, oh, it's gone down. They keep saying on the news it's getting, it's not that big of a deal. So they're doing things that are kind of risky, not so much to themselves, but risky to the community. You know, people are spreading things. I mean, people are being vaccinated and boosted and still getting disease. And, you know, some of them ignoring the symptoms like, oh, I just got a cold, it's just my allergies. They go out there and they may be affecting other people. So I think a lot of factors are involved in here. I think if we, as Dr. Phillips said, we get back to doing what we need to do to protect ourselves. If we protect ourselves as individuals, we can protect our community, because the vulnerability lies in the groups of unvaccinated. We're just now hearing that they're probably going to take the case to the FDA for the under 5-year-olds for vaccination, but that's kind of low in the field. I mean, the damage has already been done there. Look at the number of children that have been affected in the African American community. As a matter of fact, because of the vaccine hesitancy, normal routine vaccines for the first time in a long time have gone down. You know, kids are not getting vaccinated because they've taken this hesitancy to mean that all vaccines are bad for children, all vaccines are not good. But, you know, whatever people do to their children is their business. But I'm telling you, as a seasoned pediatrician, I've seen too many kids have consequences of that kind of thinking. You know, oh, it won't happen to me. It will happen to you eventually. Everybody's going to get covered. Look at Madam Vice President, boosted, vaccinated, everything she's needed to do, and she still came down with it. And luckily, she was able to get the new treatment, the Paxlovid. But even though Paxlovid, there are cases of breakthrough on Paxlovid. So, you know, this COVID, this virus, it just laughing at us. Every time we think we're a step ahead, it throws us another curveball. So I think that's why we're seeing a lot of things going up. People just got to stay vigilant. Don't take this downtime as a means like it's over, because it's not over. The pandemic phase of it might be over, but the endemic phase is here to stay. And I guarantee you, I'm not Dr. Fauci. I'm not director of infectious disease. I'm not an epidemiologist. I'm not any old things. I'm just a good old country boy that has been around long enough to know that I can see it, I can smell it, and I can feel it, and it's going to be with us for some time. So I'll leave it at that.
All right, Dr. Boykin. So, Dr. Phillips, give me a little bit about this vaccination. Are you seeing more people requesting to get either boosters or even get their initial vaccinations? What are you seeing as it relates to vaccination?
What I'm seeing is after people have made their initial push to get vaccinated, and unfortunately with the news not putting COVID as a prime issue as it has been, out of sight, out of mind. Oh, yeah, I didn't know I was supposed to get my first booster. Oh, yeah, I didn't know I was supposed to get my second booster. And I had that coming from someone who was a cancer patient who had immunocompromise and would be the person. And then, you know, when I said, well, what did your oncologist say? And the person said, they told me to get the vaccine, but, you know, it wasn't on the news about COVID, so I figured everything was all right. No. So one of the things that I'm doing in each of my visits with patients is I'm just reminding them that COVID's still here. I'm seeing where they're at in their process and letting them know what's in front of them and available to them, so that, as I said earlier, you can take your individual steps to protect yourself. And as Dr. Boykin just said, if we all take steps to protect ourselves, then we're going to be safer as a community. Again, another thing that I'm seeing, aside from just the vaccine question, again, you know, these shortcuts. Well, you know, I just got found out with COVID. Can I get Paxlovid or the other antiviral medication? And that does work, but as Dr. Boykin said, it's not 100%. And with all of those things even being said, you know, what are you doing to minimize your own personal risk? Have you started exercising? Have you started eating right? Have you started checking your blood pressure that they told you was high? And have you started taking your medication that they told you you needed to do? You know, again, the other thing is go get your preventive test done, because these other problems, I'm going to get my colonoscopy next week. Again, these other things that you need to do to stay in that space where you can deal with COVID if you got to, it takes constant and persistent attention. Because again, these variables of not being on top of our chronic conditions and having a more reactive approach to our health has put us in COVID's eye from the very beginning. And until we stop doing those things and start to make these preventive adjustments, we're going to have problems. And as Dr. Boykin just said, we just heard that Moderna and Pfizer is still not enough information to make a submission with the FDA. So that means that the vaccine for a 5 and under, individual is still not available. And we just heard how these numbers in the pediatric population have increased exponentially. And again, yes, most times the kids are going to just have a cold, but all it takes is one kid to die for it to be real serious. You ask the people that have already lost, so again, and the other thing that we don't even talk about all the time is the kids that have lost their parents to COVID. The kids that are now fending with their families and other individuals because they lost their caretakers because of COVID. Our community has been ravaged by this. And until we start to take a preventive approach in ourselves, in our communities, to improve these circumstances, because again, we're in an endemic now, but it could go back into pandemic phase at another point. And if you were in the line of fire, what have you done to reduce or change that risk that you have?
Powerful. Brother Wonzie. So just last week, I was traveling. And when I was traveling, as you know, there was a recent decision that was made. And when I went to my first destination, the masks, they were required. Everybody that was on the plane, we all had our masks. During mid-travel, information came out, and I was shocked that flight crews, and I get it, people are going to do, what they want to do. But my surprise was the actual flight crews that, flight attendants, no mask, things of that nature. Talk to us a little bit about how, where we are. And then also, from the federal side, I understand now with the federal employees, nothing will be enforced as far as the mandate of the vaccination. Give us a little bit of perspective from that.
Sure. There were two injunctions. One for there was an injunction against the president for vaccinating federal employees. That was stayed by the Fifth Circuit, meaning that it was dropped. However, we're still waiting for guidance on how we're going to execute that new ruling. To date, there have been 5 federal employees that have been suspended or lost their jobs because they wouldn't take the shots. But right now, the federal government's taking a wait-and-see attitude because the Department of Justice has got to make sure they have the right language out to all federal agencies so that we're treating all federal employees the same way. So it has been enjoined, but we have not started executing back to where we were before as far as making sure that all federal employees have the vaccination. But it's important to know that over 99.8% of all federal employees had already been vaccinated before the injunction. And so there is some relief in that because it's having a very serious effect on employees going back to work. I'll give an example. The Northeast right now, some areas counties are considered high areas. And as my brother doctors have talked about, we're now looking at hospitalization versus deaths and other things as to why for the in community transmission for the rates. Well, that has a serious impact on how people think, how people feel, how people move about. And so you have situations now where you have people, employees in offices right now, not really knowing how they're going to communicate and work with each other back and forth. The federal government is the largest employer in these United States. So we've got to make sure that whatever rules we send out are equitable and fair across the entire enterprise. Part 2 of your question was about the federal injunction on transportation. I think it was April 19th, Judge Mizell in the state of Florida. She enjoined that the government could not do that. Her reasoning, a lot of legal scholars will tell you, was flawed. However, she is a jurist, and until that is appealed and remedied, we'll go on the way we are. There's 2 parts of that I really want to talk about. The first part is this. What she did is she's effectively hampered the CDC or the federal government in the future for being able to mandate certain actions in the point of any kind of pandemic or any other kind of medical or natural catastrophe. So people got to understand that although they may cheer the fact they're not wearing a mask anymore, what is really concerning is the fact that it hampers the government's ability to react and respond in the future, any kind of near-term pandemic or crisis. Point number 2, the federal government was looking at releasing that May 13th. So I know that there's been articles in the news where the DOJ is going back to appeal that. And the reason they're going to appeal this, Brother Mfofo, is to make sure that we have that tool in our arsenals that we can use later on in future times we need it. Because I will tell you this, as my brothers will back me up, it's not a matter of if, but when it spikes. It's not a matter of when the next one's going to come along, and we've got to be sure we can do that. Another point I want to make is that the federal government is almost broke when it comes to money for defensive posture for COVID variants. For example, there's a $10 billion bill in Congress right now that we're trying to get passed so the federal government has some money to take preventive measures and things so we can make sure we are on the lookout. We can look over the horizon to make sure if something's coming down the way, we can respond to it. It's very scary when you're sitting in an office and you're talking to people, and the CDC, the U.S. Public Health Service, and other entities that are charged to maintain the safety and security of these United States from a medical or from a pandemic perspective aren't able to do the jobs. And so again, we've got this thing caught up into politics, and I hope and pray one day we'll get to the point we can look at the science of these vaccines, of these pandemics, and look at them for what they are and not for what we want them to be from a political perspective. And until we get there, we're going to always have this on our hands. Dr. Fauci said something this morning, and Brother Boykin talked about it as well. This pandemic is here to stay. The question is, how do we handle this pandemic? And the question is, how do we do it as a society so that we can go forward? Because we don't want to be in a situation where every time we do something, we're always looking over our shoulder and thinking in our mind when someone coughs, is this my time? Is this going to happen now? Is this for real? And these are the things that people are going to have to start living with until we get a grasp of this as a mature society to say we've got to deal with this once and for all and let politics be damned and do what's right for all of us as Americans.
So, Dr. Phillips, to your point earlier, right? People are fed up, and I think everybody's made a reference to it. People are fed up. People are tired. What should people have been doing? We're talking over 2 years. It's been over 2 years we've been dealing with this. What's your advice? What's your take on what people should be doing right now as it relates to where we are with this COVID-19?
Take care of your health. I think, we've heard people say, I want to boost my immune system. I want to do these things. The first thing I would say is, what are you doing from a preventive standpoint with your health? Have you had your physical? If you have a condition, have you been monitoring it as you're supposed to? In addition to that, I think you need to, if you haven't been vaccinated, reapproach that question about vaccination. If you have been vaccinated, make sure that you've at least done it to a point where it's protective of you. Because if you got one shot back in March of 2021, that's not really doing anything for you right now. In addition to that, I think you've just got to be thoughtful on gathering. And I think the bigger risk factors are indoor with a lot of people. I mean, it's hard because it's nice seeing people. I was at an event, a gala last night, and, it was hard. You wanted to see everybody, but we had masks on. Every time you got up from your table or wasn't eating or drinking, you had a mask on, and again, I was particularly diligent about it because I was with my mother, who's 80 years old. And, I don't want coming out with me for a festive occasion to be the last time that she goes out. I just try to put the risk in front of people that they're facing with the choices they're making. And, if that happens, you may be in a situation where call me up, monoclonal antibodies or a pill, that may not be able to pull you out if you haven't been on top of your issues. Again, one of the things that was mentioned lightly earlier is what you're doing with your head and your spirit. What is your plan with that? I think, again, it's very important for us to be intentional. Not, I got time today, I'm going to do it. You got to plan it just like you plan everything else. And I think in doing those multifaceted and layered things, we are in a better position to protect ourselves individually. And the other thing that I think we got to do, if you're in a community that has been suffering because of lack of resources with COVID, what are you doing with the political landscape in your community? Are you involved where we're trying to make some policy decisions? Maybe we don't have a doctor's office. Maybe we need a proper medical facility So that could be a space where things can be dispensed if needed, if the pandemic returns. So I think there's a layered message that I'm trying to give people, but again, I think it's important to really make sure that people understand, as Brother Gardner just said, you can't blame it on the government no more. The government has said it's on you. You've gotten all of the information there that you can use to protect yourself, and really it's up to you. And at the end of the day, don't be that person that has been, as just in the middle and not decisive. And now when something happens, now you want to get a shot. It's too late if you got sick. It's too late if you have not been on top of your conditions. Again, once you have a stroke, everything is different after that. So I try to preach a preventive approach. I try to make sure that people understand the layers of what that prevention means. And I just try to be a nice pain in the A. You know what I'm
saying? Dr. Boykin, talk to us a little bit about your thoughts on, say, there's obviously people that are still, and for whatever reason, they choose not to get vaccinated. And they say that, listen, I'm not vaccinated. I haven't been vaccinated. I haven't caught COVID. I'm just doing just fine. Talk to us, about your thoughts.
Sure. I mean, as Dr. Phillips said earlier, and I've said many times on these particular broadcasts, it's not a matter of if, it's a matter of when you're going to get COVID. And we know a lot of data is still coming out about, the effects of COVID in different communities, what's the long-term, but what's the vaccination effects. I mean, all this stuff is being studied ad nauseum right now, in my opinion. But think about it. I can't think in all of my 30-some years of practicing medicine why one single vaccine has become so politicized when we in the throes of a pandemic. I mean, look at the flu. I mean, I get it. Everybody doesn't want to get a vaccine. And I'm not going to beat you over your head and say you're stupid if you don't get a vaccine. It's just your choice, and you have to live with your choice. But look at the flu. If it hadn't been for flu vaccine, it hadn't been for people staying on top of the flu vaccine every year, I wonder how many people would be dead from the flu if we didn't have these vaccines and people studying them every single year. Because I know when I was with my last office, we knew probably around this time, or maybe in the next couple of months, what vaccine we would be looking at giving in the fall for the upcoming flu, because we based it on the previous time. So think about that. We're saying this is an endemic. People just kind of like, well, it's an endemic. It's not a big deal. Well, endemic is not as innocent as people think it is. Endemic means it's here to stay. So if you don't want to get vaccinated, it's just your choice. But let's think about it. If more of us get vaccinated, how can we put a damper? How can we put a dent in this? People say, well, I can go just take this, I go take that. Well, everybody worry about the ingredients in the vaccine. Well, how many times do you go to 7-Eleven, eat one of those nasty hot dogs? You don't know what's in that. How many times you go somewhere and you pick up something to eat or drink, without reading the label? Part of a good health is reading what's on the label. I understand that. I get that. And when you're trying to do something, healthy wise, you should do that. But we know what's in the vaccine. We know how it works. We know what's out there. So that's the same as reading the label, in my opinion. But yet people still choose to ignore the facts, ignore the science. I've heard so many times people say, well, I'm just going to wait and see what the Lord does. Well, God has given us the answer. I'm not trying to push my religion on anybody at all, because I am a believer. But I've always said that, we as doctors only dress the wound, but God heals the wound. And God gave us methods, how to prevent COVID, how to deal with, COVID, what to do once we get COVID, without, man having some type of knowledge from a supreme power, whoever you believe in, we just didn't come over this out, out there. We just didn't pull out our rear ends. Somebody had to have a knowledge. Somebody had to have an impact to get this done. So, people talking about, well, the vaccines were out so soon. No, they were not. The technology has always been there. We just thankfully had it when this pandemic hit. Okay. So if you say you don't want to get the vaccine because it was done too soon, well, the Novavax is out there. That's been almost now 2 years, still coming to fruition. So there's a vaccine for you that's been added the normal way, and that has pretty good efficacy out there right now. So, if you don't want to get a vaccine, it's fine, but just think about it. If it weren't for vaccinations, where would we be with polio? What would we be with MMR? I remember back in my younger days when people always talked about the MMR giving you autism, and a bunch of people in Philadelphia didn't vaccinate their kids. Well, guess what? A bunch of kids died from a common childhood disease called measles. Senseless, worthless, because we had the technology there to deal with it. Because somebody spread some misinformation and it went like wildfire. I think one of the biggest, it's probably getting good and bad points. So the biggest problems we have now is the social media platforms. You know, they're great for spreading good information, but they're just as bad for spreading misinformation. You know, I belong to a cancer group, and I can't tell you the beginning times how many misinformation, because it's an international group as well, but I can't tell you how many things were misinterpreted because people were talking about what was going on in their country, and people in this country were taking it for the gospel because it was the United States, but it's not the case. So make sure you understand what you're dealing with. Don't go out and just pick up something because it was on social media. You know, do your due diligence, research it. You know, like I said, if you want to get vaccinated, I'm all for you. If you don't want to get vaccinated, then do the next best thing to protect you and your family and all those people you're going to encounter, such as people like me, if I hadn't been vaccinated, that may be, you may be a carrier, not even know you have COVID and you're giving it to somebody like that. You know, I think it's the biggest problem in our schools. People want to have freedom of speech. Well, I'm sorry, but that's BS. Freedom of speech has nothing to do with protecting the community against the disease. Just because you want to go and send your child to school without a mask, what about the other children that have to go to school the same token that have some underlying conditions such as immunodeficiency? A lot of children have these, asthma. There are a lot of children out there with cancer, okay? And for these people to say that, you know, it's my right not to send somebody to school for masks, well, is it your right to make that child be exposed to that disease because you have freedom of speech? Think about it. You know, think about it. Let's be sensible when we say these things. When we get on the platform, they have a whole lot of things to say. Think about who you're going to impact and think about yourself. I can't tell you the number of people that had such a big political idea about what's going on and no longer with us because they expired from COVID-19 because they were misinformed. So I'll leave it at that, brother.
Yeah, well, let me ask the doctors this, and then we're gonna come to you, Wonzie. So for the doctors, and I think it was Dr. Phillips, I think you mentioned it. So it is flu season. It is, you know, this weather's been crazy. One day it's 80 degrees, the next day it's back to 40. So the common cold or the flu, whatever the case may be. So if somebody gets a cold or whatever the case may be, allergies, whatever the case may be, what advice, what recommendations do you give to them in case they're paranoid or you know, thinking that it might be COVID?
Well, I think, you know, we've got rapid tests that are available and you can do a rapid test. I would recommend repeating it in 24.
That's the plan, wasn't it?
That was a part of
the. I would repeat it if you're still symptomatic in 24 hours, so that if it is negative, that you can feel assured that it's not COVID, because the rapid test, and you know, has a significant degree of inaccuracy. So you know, you don't want to say have it negative and you're like, okay, I could go visit my grandmother tonight. And unfortunately, she may have different risks than you, and then you leave her with something that she can't get rid of. So I think the important thing, you know, when you find out is get a test. The other thing is if you know you have allergy symptoms, maybe now is the time to start taking your medicine just to control those symptoms. The other thing that we're doing, you know, we're also checking people for the flu when they come in. So if you come into my office, you're going to probably get a rapid COVID test and a rapid flu test just to confirm. And again, I think it's important to let your doctor know, because you may have risk factors. And if you do have risk factors, medications like the Paxlovid might be a good option for you, which is the antiviral medicine. An important thing to just keep in mind if you are asking or having your doctor prescribe that. I know in the New York area, on the prescription, they want to know, when did you first start having symptoms? So the date that you first started having symptoms, because they would prefer it to be within 5 days of the onset or when symptoms began. The other thing they're asking on the prescription is the most recent glomerular filtration rate, which is a lab value that gives an indication of your kidney function, because these medications can be hazardous to someone that has impaired kidney function. So I hope that answers your question, bro, DR.
I think so. Dr. Boykin, did you want to chime in at all?
Well, the only thing I want to add to that, I mean, and Dr. Phillips is absolutely spot on. But if you come down with a cold or flu-like symptoms, I want you to think back, like, where have I been? Have I been to a large gathering somewhere? There was a case of a physician who was also a breast cancer survivor, and she was fully vaccinated, and she had COVID, symptomatic COVID. She tested positive. She took Paxlovid, and she had another case of it. But she was not considered immunocompromised because she was considered a breast cancer survivor, although she was on long-term treatment to prevent recurrence of it. But think about it. She went back and thought through where she was at. They were at a big reception somewhere indoors. Okay. Now I've been to large receptions myself, but they were outside, and one of them I went to was a family gathering, and they, without even consulting me, had to make sure everybody was vaccinated. You couldn't even come if you weren't vaccinated. But just think where you've been, and just think if you got something that's a little bit more than your normal cold, man, this sore throat is kind of weird this time. Think about getting tested. Man, my allergies is just kicking my butt this year. Think about getting tested, especially if you've been taking your medications, if you know that you have had those medications that have worked for you in the past. So those are things I would say to you. If you got a cold, you got the flu, and please, by all means, if you're not sure, get tested. Get tested for both, as Dr. Phillips said, because the flu is not as innocent as folks thinking. I mean, it can knock you for a loop. And unfortunately, the flu is a killer of small children and elderly people. So you've got flu on top of COVID. You want to know what's going on, so go get tested. Tests are readily available now. You can walk in any store right now. Right at the checkout counter, there's a stack of COVID-19 tests. So there's no excuse why you can't be tested anymore. But these home tests are readily available for you, and they're approved by the FDA.
Outstanding. Brother Gardner.
Brother Fobo, I got a question. I've heard the term telemed and telehealth. I sit here in amazement and just listen to my two brothers, these two doctors, talk about stuff free and no charge to people if we just listen. It's just amazing how good God is, the things he will give us if we just listen. And I'm sitting back marveling, listening to these two brothers talk from stuff that God has put inside of them, willing to share, just ask people just to listen. It's just amazing. You guys are awesome. Totally awesome.
I just wanted to add on to what Wonzie's saying, and say if you get symptoms and you're not that sick, we do telemedicine visits just to give people, because it's still just as scary for anybody right now once you find out you got COVID. I'm sure in that first moment, you're like, am I going to die? Is this going to be hard on me? And when people are in that moment, they need some direction on how to proceed. What do I need to do? What are my expectations about symptoms? When can I go back to work? How do I engage with the people that I live in the house with? And I think it's important, as Wonzie just alluded to telemedicine, to recognize that that's an option for you. If your doctors say can't see you in the office, sometimes we have too much going on in the office and I have to do it via telehealth. It still allows me to see the patient, to give them the information they need so that they can recognize what they need to do, and most importantly, recognize when there is need for an intervention.
So the point I was making it, we always talk about access and not an inability. I'm just coming to the point that if we really want to get it, we can find it. And brothers like Brother Boykin and Brother Phillips and Brother DR, yourself, and others out there on the front lines trying to do things, getting people out there. If they really want, they can get it. And I just want to stress again that this has now become a personal thing. It's always been personal, but since the government's moving out of this, it's going to be very important that we as a community decide about individual responsibility. And there's something I always tell people all the time: the ultimate measure of a man or woman is not where they stand during times of comfort and convenience, but where they stand during times of controversy and challenge. Dr. King first said that, and so did Abraham Lincoln. But it's just a pillar in my mind about where do you want to stand when things are controversial versus convenient. And right now, this is very controversial, right? And so it's hard trying to stand on the side of right, because sometimes you may not feel like you know what right is. But I do know this: when you have close to 1 million people dying of a disease in a country as big as ours, as great as ours, with all the technology, there's a problem there. And so for those out there listening to us, we're not just doing this for our own sake. We're hoping that something can be said, or something will be a spark to you where you will take something and remember, because as Brother Phillips just said, until it happens to you, no one knows how you're going to respond or react. We've all been running. Some of us may have gotten COVID and got over it, but we're still running. Every time I hear about someone close to me getting COVID, I ask that question: what's next? How am I going to respond? How am I going to act? And so far, knock on wood, I haven't caught COVID, but no one knows how you would be or how you're going to act. And so the best prevention is just some knowledge and some prayer that you'll get through, number one. But I'm just in awe and humbled to see here and sit to listen to these two brothers and Brother Guyton, and see all the work they're doing on the front lines, trying to keep everybody safe and getting out this information. It's just amazing. I just hope someone's taking it in tonight.
Outstanding. And certainly, Dr. Guyton, we know all of the things that he has contributed, all of that he has going on, and we certainly we're not going to forget. Like I said, it's the four horsemen.
Yes.
The four of y'all have just truly been amazing, just truly been a blessing, not only to our organization but to the community, as now people have been able to get this information worldwide. So with that, we're going to wrap this thing up. So Dr. Boykin, we're going to start with you for your closing comments.
Thank you. And again, I just want everybody to recognize that we could not have done this without Brother DR, Brother Mpofo. This was his brainstorm, and we all, with this monthly type thing, it was his brainstorm, and we all fell into it, because I look at it as a way to get information out there, because I can't get out there and get it to like I would want to. So I say to you, just remember, folks, things might be a little bit low right now, but you always go through a valley before you reach the next peak. And I'm not saying there's going to be a big surge, but cases are rising. We need to be cognizant of that fact. You need to do what's individually good for you and your family and your sphere of people that you get around with. So if you know you're going to go somewhere and you're going to be in close contact and there might be poor ventilation or whatever, do the right thing. Either test yourself before you go, get your vaccine. Realize it takes 2 weeks to build antibodies, but test yourself. Make sure you have a mask if you're going to be in close proximity to somebody, and especially if it's a place that's closed with no ventilation. So do that. If you're going to go to outdoor gathering, I would still do the same thing. Be cognizant of what's going on there. Make sure you wash your hands and do as best you can to prevent the spread of it. If you have any symptoms at all that you're not sure of, please go get tested. I mean, walk into any grocery store, any pharmacy these days, right there, the checkout counter, as I said earlier, there's a COVID test. The government is giving out free COVID tests. They gave out free second round of free COVID tests, but now the money is dried up because we haven't got any funding to continue to do those things. So, but they're out there already for you. Churches are giving out free testing. There are a lot of people, community leaders that are not physicians, that are putting the information out there and getting access to things for you. So, you can do what you want to do and try to enjoy your summer, but just make sure you protect yourself and protect others at the same time. So we as a community, particularly the Black community, African American community, can protect ourselves, because we always are the last ones that have access to care. A, because we don't have it, and B, because we don't trust it. So put your trust in the system and go out and do the right thing and get yourself protected summer. And please have a good summer. Just remember, fall is coming. That's when flu and COVID are going to surge again. So just remember that. Thank you.
Thank you, Dr. Boykin, as always, giving us the facts just the way we need them. We appreciate your service. We appreciate all that you've done. Thank you so much. Dr. Phillips, your closing remarks.
And we call him 98, a.k.a. Brother DR. Brother DR, thank you. I am saddened a little bit that this is the last remarks I'd be able to give with you at the helm. It's been a pleasure, my brother. I appreciate, as I told someone in the beginning, as a medical provider, COVID provided an opportunity, like say a football player plays in the Super Bowl or a basketball player plays in the NBA championship. This COVID has given, as a medical person, a challenge to be in something like a Super Bowl in order to make a splash or make a difference. And you've been, all up in that, Brother DR. So again, man, much appreciated for the work, not only in the health fair, the health aspect of our fraternity, but on other aspects of your leadership in the 2nd District. But what I'm going to say about COVID is this: we've given you the information and we have let you know that it's still out there. It's really up to you to look yourself in the mirror and say, well, what am I doing to make sure that I'm protecting myself? Am I taking care of my chronic conditions that I have? Am I checking up on my health to make sure if there are any issues that I don't know about that I find out about. If I'm eligible to be vaccinated, am I fully vaccinated according to my eligibility? If I am out and about and I'm in a space that may be deemed as unsafe, or if I'm in an area where the COVID cases are on the increase, am I masking and taking other safety precautions to protect myself? And if I do get COVID, am I getting in contact with my doctor to find out what my options are, whether it's just dealing with the symptoms because they're very mild, whether it's do I need one of these antiviral oral medications because I may be at risk for complications. So again, you've got the tools here. It's a matter of using them. And again, I think the last thing is making sure that where you do get your information is factual and accurate, because as it was stated earlier, we have seen that there's a lot of investment in misinformation, y'all. So let's not be a victim of that investment. And with that, I yield my time. Again, Brother DR, thank you, my brother.
No, we appreciate you, Dr. Phillips, again, from the very beginning, New York epicenter, and you just jumped right out, and we appreciate you and everything that you've done for us. Only for tonight, last and certainly not least, of course, we've already mentioned Dr. Guyton, but he couldn't be with us tonight. So Wonzie's going to bring it home for us. Brother Gardner, your closing remarks.
Just make sure. It's been a pleasure and honor to be a part of this historic team for so long, 2 years. And you guys have given me a space to grieve, to mourn, to grow, and to try to heal myself. Today, I met with my therapist, and we were talking about the various facets of life and how things happen for a reason. You try to figure out why things happen to good people and why things happen the way they are. And when we do that, we try to put ourselves in God's role. We can't do that. When we look at this pandemic, the four of us plus Brother DR, we have tried to give you an insight into some things that we have been feeling, we've been going through. I, by no means, am a medical doctor, and I don't even try to pretend to be. I'm just a guy that was involved both personally with loss and made a commitment through what I do at work and this organization to try to bring information to you that you could use. The urgency of now is so crystal clear that we have got to stay focused on what we're trying to do and how we're trying to do it. As Brother Phillips, Brother Boykin talked about how we are all tired. This is turning to an endemic versus a pandemic. But I want everyone under the sound of my voice to recognize that it could be a pandemic or an endemic. The effect will still be the same when it hits you or one of your loved ones. We can't take this virus lightly. We can't take the time we're in lightly. We all know that when it comes to this society, we as a people are normally the last ones at the table. And when you're the last one at the table, you're the last one to either get what's either being offered or what's been withheld. Either way, our community has suffered quite a bit. And many of you under the sound of my voice, like myself, have had major loss. Losses that irreplaceable loss where you will never be the same. As I said earlier, I was talking to my therapist, and I'm trying to deal with my new normal, trying to make my new normal here. But every night when I go to bed, I think about those that I've lost. Every morning when I get up, I say a quick prayer and I talk to my dad, I talk to my mom, and I want to grab my daughter. And I say these things to let you know that the pain, the agony, and the scars, they are real and they don't go away. And you ask why we do this we start every weekly and went to a monthly and then seminar and everything. Why we still doing this? If we can help but save one person because they did the right thing. We told them about getting the shot. We told them about the preventive things they can do. We told them how to act in a crowd and what to look for, the symptoms when they started feeling bad. If we can help but save one person, then this has all been worthwhile. I remember when we started in the LGG, it was an idea by former DR Shorty Bang Bang. And he said a what if proposition. What would happen if we decided to get together as men under the shield of Omega and try to talk to our people? what could happen? How could this thing grow? 2.5 years later, here we are saying goodbye to our DR now, who has led us and guided us through this journey for such a long time. It's amazing what happens when you let God go, when you let God lead. It's amazing what happens when you get brothers who are really committed to a cause to try to help our people. So tonight, as we end under the tutelage of Brother DR and Fofo, I want to say thank you. I'm honored. I'm humbled to be a part of this, and so blessed to be one of the greatest attorneys in the world. God bless you all, and thank you very much.
As always, Brother Gardner, you shared a story with all of us, and that's just the whole world, and how this COVID-19 impacted you, touched so many of us, and continues to remain in our hearts and our minds. Brother Wonzie, man, we love you. We appreciate you. And we just say thank you, because you didn't have to do it. But instead, you chose your fraternity. You chose the community. You wanted people to know. And I believe because of you, because of all of the horsemen, we have changed lives. We have made a difference. To the brothers of the 2nd District, to our friends and family who have been watching, I just want to say thank you. We hope that you have been able to obtain some information that, is just basically giving you the information you need to make an informed decision. And certainly, I don't do this by myself. We don't do this by ourselves. So, of course, in the absence of Dr. Guyton, we salute Dr. Guyton for his support. We certainly salute all the people that have helped us make this possible. The brothers working in the background. Brother John Piercy, he's the one that puts us in and out, and making sure that, music plays and all that stuff. Brother Piercy, we appreciate you. We love you. Brother Ed Hill, Brother Tim Worley, these are brothers in the background, making sure that brothers can get this information no matter where they are. So we thank all of you. Brothers of the 2nd District, we thank all of you. We'll see what the new DR wants to do. If he wants us to keep going, I'm sure we'll find a way to keep going. But at the same time, we're going to be mindful that this thing is not over. Thank you all so much on behalf of our Grand Bosslers, who has allowed us to do these things and has allowed these horsemen to come to the Supreme Council meetings to share this information. And these brothers have made an impact on how we moved as a fraternity during this pandemic. Dr. David Marion, thank you for your leadership and all that you've done. Certainly to the brothers of the 2nd District, we thank you. As I always say, make sure you make time to give blood. We know how important it is. We want to always be supportive of our brother, Dr. Charles Drew. So with that, have a wonderful weekend. I will. Again, brothers, thank you, and God bless. Have a great evening.